All right, thank you. So the first thing I want to start with is just kind of give you an overview of of where we started, how we came up with our idea, our conclusions. You know, last school year we ran a trial period. This year was supposed to kick off the research. This year was the beginning of our research project, and we've made a few adjustments along the way. So I was going to talk a little bit about some of the obstacles we came across, methods we used to try to solve those, and then the things that we're looking forward to going into next year. So basically the statistics that kind of caught our attention, and was kind of what we saw as our call to action. The things that stuck in my mind was, female injuries are up 300%, and the fact that of those injuries, 75% of them are non-contact. I found that to be alarming. We discuss all the issues with females, the hips, the valgus stress, those things. And while those things are true, my interest is why is it up? The anatomy hasn't changed, the participation hasn't changed that much. So what are the issues that are driving these numbers going up in the ACLs? But the backbone of our research was, going on the new research of valgus stress increases the rotational component of the knee. Once you increase the rotational component, you introduce the risk for any ACL injury. The fascinating thing now is we don't know what leads to the valgus stress. They discuss, the wider hips of a female, the Q angle, hip weakness, asymmetries. Myers actually went around and measured the length of the tibia and said the longer tibia led a longer axis, so when they valgus, they went in harder, and those people were more likely, and he found research to support that. So our idea was to take and look at these things, see which ones were consistent, and then see if we could find a common thread. Right now, we know these things are valid, these concerns are valid, but we don't know, is it 2 degrees, is it 5 degrees, where does the valgus stress generated from, what can we do to improve it? Those things are still the unknowns that we're looking for. So we're hoping to find things that we could use as practitioners in the healthcare industry to help reduce the factors and rehab quicker. And then we also wanted to provide information to athletes and coaches in order to help the coaches assess their programs, to check their off-season programs and see how effective they were, as well as help the athletes be healthier and more competitive. This is, let's see if I can get my video to work. Excuse me. How do I? Can you click that one? Oh, there it is. Okay, click on this one. And click on that one again, please. Thank you. So this is part of our first year research. We tried to do a single leg jump. Oh. Can you back up? Or I can back. There you go. So our idea was to do a single leg jump with a force plate. So the athlete was instructed to hop as high as they could for 10 seconds without putting their foot down, without falling off the plate. So some of the issues we ran into was, or the two biggest problems we had was, one, they would fall off the plate. So you can see the force plate's the gray part, and then we built a platform around it for their protection. And the biggest issue we had initially was they would just fall completely off of this thing. And this thing is 2 foot wide and 4 foot long. And they were unable just to hop up and down in that space. So we put the cones around it, as you can see. And for some reason, the visual barrier seemed to help a little bit. We had less of them fall off. Then we started having, the second round of issues we had was either we were getting this, where they were so worried about falling that they wouldn't jump, or they were putting their foot down too many times and it would throw an error to the force plate. So the first year we tested, it was around 150, 160 athletes. I think we ended up with about 25 sets of data in the single leg jump that was that we could use. And if you look, these were 2 that we could use. And this is kind of the spectrum of what we saw. And you can see the rotation going on there. And I mean, she fits the category of the things we worry about. There's no hip movement. She's jumping all with her arms. This was probably the best one we had, where she stays pretty consistent. You don't see a whole lot of rotation in hers. So the issues we had in the first year was we started off kind of bragging, no one has ever attempted a field research project of this magnitude. Meaning, there's been 5 or 6 groups try to replicate this research, but it's always been done in the confines of a lab, where they asked for volunteers, they paid small fees to have people come in, they tried to bus teams in. I think the biggest study was about 2,500 athletes that was done in Indianapolis. They spent something like $1.5 million in 3 years, and their data was inconclusive because they only had 8 ACL injuries in their study. So, but as we got going with our trial, we learned that there's a reason it hadn't been done out in the field, and a lot of the issues we came up with to address in the trial year. The biggest one was our marker placement. What we were doing, if you look at Meyer's research, which is what we kind of mirrored, he had the female athletes wear like the short 70s style running shorts where the greater trochanter was exposed, and he stuck his markers there. Well, we knew that wouldn't fly, so we asked him to wear volleyball shorts, sliders, whatever you want to call them. And we tried to stick the markers on there. And that turned out to be a big issue. Female athletes were uncomfortable being videoed wearing biker shorts or whatever. So that caused a problem, something we had to fix going into the second year. We had issues with our data. We were measuring the length of the tibia, calling it out to somebody, having them write it down, then having to go back and enter that into a spreadsheet, and then take that data and enter it back once we broke down the force plate data. So it was taking too long, and there was too big of a chance with all the different times we were transcribing these numbers of getting them jumbled up and corrupting our data. And the other problem we had is the testing process was just too slow. That, the coaches don't want to give you more than an hour's worth of time. So if you're looking at 30 athletes in an hour, you have 2 minutes per athlete to get everything done and get them back to the coach. So we made some revisions going forward into this year. One of the things was, as Dr. Cassio mentioned, the Foundation for Fair Play agreed to purchase 3 carts. So what we were doing was using mobile carts with cameras and all of our software and that, so we can capture the data in the schools. Well, the Foundation for Fair Play purchased 3 more carts to give us a total of 4 to allow us to collect data quicker. Steve Swanson, the research scientist with Athletic Republic headquarters, agreed to donate a second force plate. So our idea was we would run 2 force plates and we could cut our data time in half. And then what we realized was, at the end of the day, we still weren't generating anything that the coaches could sink their teeth into. So we added doing the 5-10-5 shuttle using the Fusion timing system. So it was, so we're capturing it with video and laser time, because if we believe that hip strength is a factor in valgus stress, then a measure of strength is change of direction. The shuttle run is a measure of change of direction. So our thought going forward into this year was, if we could do the shuttle and we could link valgus stress poor jumps to a poor shuttle run, now we've got something that a coach can test, that we can something measurable to see if our interventions are working, if there are off-season programs working. So we added that in for this year past. We ran into a few snags along the way. Our cart, the first cart we purchased, that Athletic Republic purchased, was narrow. As we hauled it back and forth on and off a trailer to the different schools, we had wheel failure. We had issues with it tipping coming out of the trailer. So we had the manufacturer redesign the wheels and push the wheels further out on the cart to make them more stable for travel. So that ended up holding up our project about 3 months. Dartfish, which is the video integrated software that we use to break down the motion analysis, they decided they were going to upgrade. They went from Dartfish 6 to Dartfish 7, and they went to all high-definition cameras. So the cameras we purchased were no longer valid for our research. We had to exchange those and purchase high-definition cameras. Steve Swanson also agreed to loan us the high-definition cameras in order to get rid of our marker issue. And then we added the shuttle run. So coordinating that were things that kind of slowed us down in our data collection. We didn't get started until closer to Christmas instead of getting it started in August like we wanted to. So this was the new data, or the new method of markering was by putting the clusters on, it was much quicker, and by using the Velcro straps, the athletes were allowed to wear looser clothing, which they seemed to like. We were able to hold our markers on using rubber bands, so that sped up our time a little bit. And the software, if you see she has 4 markers on one side, 3, and then 4, and then 3, the software is able to identify that. So by putting our markers in consistent spots, the software measures the length of the limbs. The software knows the right leg, the left leg, where the knee is, and the software can determine all of that without us having to manually calculate it. And this is what our drop jump looks like now. And this is just taking the force plate. So you can see, it's kind of hard to tell with this setup, but the difference in the high definition camera versus the videos I showed you earlier, they're much more darker. And if you can see the tape all over the front of the box, one of the issues we have as well, which I think I have in a later slide, was with the Dartfish software, with the 3D software, which is, if you've ever watched like sports science or watching the making of a video game, that's the same cameras that they use. Everything behind it has to be dark. Well, originally this box behind her was painted with a gloss paint. So when we would get in some of the gyms, if the light, typically they put us underneath the basketball goal, so the light off the goal, or the light would catch the box and reflect off of it. So we ended up having to go around putting tape on it and different things to try to kill that reflection. And that's a pretty good land right there. So these are what the cameras look like. This was kind of the day we got it, setting it up, using it in center, trying to see how it works. There's a picture of the software and kind of how the cameras are set up, which is another one of the things we had to work through was all of the cameras have to be consistent. So we had them on 3 individual tripods, which typically you're in a lab, it's no problem. They're mounted and they sit there for years. For us, having to pick them up, put them in a box, take them back out, we ended up creating a PVC pipe rail where we could adjust the heights, get them where we want, and then we mounted the camera mounts right there. So that way, as we go from school to school, we just measure the distance from the force plate, center it, and we can keep our cameras collecting data consistently from location to location. This is what our software looks like now. That's the front view. So you can see right there, it's set, all 4 cameras are showing you what it would look like, a front view focusing on the patella. And then there's the side view. Can you see that very well? But basically what it allows us to do is because of the fact that the software knows what each one of those clusters means, you can focus it on there and it's going to give you and then we'll come back up. It'll give you in the frontal plane and the sagittal plane what those joints are doing. So we can look and see when the knee's going in, how's it going forwards, backwards, and that gives us a lot more conclusive data. Saves us a lot of time on collecting, on analyzing the data. This was a factor that we didn't expect when we added the shuttle in. An issue that we're going to have to work through going forward into year 2, and you'll see it right here. We found a lot of times that the females would display shall we say, non-competitive behavior when it came to the shuttle. I don't know if it was being self-conscious or not being familiar with the drill, too many spectators, trying to be cool. I don't know exactly what happened, but we didn't find a consistency at all in what we saw in our valgus numbers versus what we saw in our shuttle scores. And I think that is more behavior-oriented rather than actual problems with the data. So that's another issue that we'll have to address going forward. So the adjustments we're looking at making going into year 2 is we found that the coaches and athletes still don't exactly know what they're doing. So we're looking at creating some sort of brochures that we can hand out to the coaches and athletes ahead of time and kind of keep them informed of what we're doing. We have the lighting issue. We're looking at trying to create a green screen, kind of like they do with the weather, in order to try to kill some of those deflections in order to save time on our setup with the 3D cameras. We have secured a second fusion timing system, so we're going to add a 20-yard sprint into our testing, which I don't know if it'll generate any data from the ACL point of view. We'll see. If linear speed is going to play a factor. But what I'm hoping it'll do, if nothing else, is it'll decrease the number of kids standing around. And I think if we decrease the number of kids watching, maybe we can get better information out of our shuttle run. We have a GA from McNeese who will be coming to help us. That's another thing that we didn't think about, is maintaining all this data, cataloging it, making sure it's tagged right, and storing it, because the video files are so big that if we leave them on the cart locks up because it can't run with all that data, that storage. So they're going to have to be pulled off, saved on the hard drives and catalogs. So we have somebody coming in to help us in the fall that will just tend to that aspect of it. As I mentioned earlier, before, the issues with the 3D cameras, on trying to make them where we can transport them and still stay consistent in our camera angles, and decreasing data time, because we're still looking at, the coaches are expecting an hour to be able to test 30 athletes, so we're going to try to collect as much data as we can in 2 minutes. One of the things we're going to do is with the second force plate, instead of doing the single leg hop, because we ran into so many errors and our data didn't work out for us, is we're going to mount the 2 force plates side by side. And what the athletes will do is, standing on the box, when they jump off, they'll jump with 1 foot on each force plate. So we can get a single leg jump. So we can get a drop jump, a single leg jump at the same time. And then right now, we're taking our Vertec and we're modifying the arm to extend it, where we can extend it over the force plate. And what we plan to do is do a drop jump, a vertical jump, and then a drop jump with a vertical. And we think by doing those, we can collect all of that data that we need and save time. By doing it that way, we'll get multiple data from one jump. And then the locomotion from the 20-yard and the cutting maneuvers from the shuttle run. This was something we did in center, just kind of evidently I didn't save those files right, because they're supposed to play at the same time. But this is the before and this is the after. And this is a female athlete that came to Athletic Republic after her ACL rehab. So she had gone to therapy and was doing fine. By all means, was healthy, 5 out of 5 strength, full range of motion, no swelling. However, as you can see, she's real uncomfortable running, having difficulty performing. So what we did was, for our own ideas to test our own theories out was we treated her every day for 10 days. And we took a pre-test using a force plate mounted onto a leg press. So she did a single leg, isometric, right and left, and then a single leg dynamic of pushing up against the force plate, pressing. So what we found was, initially, she had, well, let me go back and talk about the treatment, sorry. So what we did over the 2 weeks was we didn't do any knee rehab or any of the traditional knee rehab. All we did with her was made sure she maintained full knee extension by doing long arc quads, and then we slowly loaded her from a plyometric point of view. We put her on the leg press at a very light weight and had her jump and catch herself. Then we moved her on. We have a custom plyometric floor. We moved on to the plyometric floor and started basic dot drills, jumping point to point. And within 10 days, we saw a drastic improvement. You can see an improvement in her running. She's still not there. But what we were able to do, if you look at her isometric, pre to post, was she was able to make a 10% gain on her surgical leg. And then a 10% gain dynamically. The difference between her lower body pre and post was an 8% gain and a 6% gain overall in dynamics. So I thought that was pretty interesting information. Again, it's only one, so it doesn't really, I guess, count as research at this point. But she was able to close the gap. She was able to improve her power, definitely improve her function by simply doing loading exercises. Her lower body strength improved. We didn't do a whole lot of squats and a lot of the things that we would typically do with athletes. It was simply just loading the tendons, jumping and rebounding and things like that. And we got a pretty significant improvement in power and strength. So we've had to make several adjustments along the way, learning that no one has ever attempted a field research project like this. I was a little disappointed this year. I was hoping that we would be somewhere around 2,000 athletes tested by this point. We're a little over 400 instead. But I feel that the issues we've come up with or we've ran into has forced us to change our research in a way I think that will be a lot better. I think we'll get better information for the athletes' kids. I think we'll gain a lot more knowledge as practitioners. So I'm looking forward to making those adjustments and seeing how things go next year. Does anybody have any questions?